And Virginia, from a creative perspective then, what makes a collaboration compelling for you and what value do you get?
There are so many value points besides monetary compensation, and I want to focus on those today because the amount that you might get paid between different brands can vary so much for lots of different factors. So the first thing is having access to a professional team and working with the clinical team at the NHS who follow the NHS guidelines and standards that YouTube is pushing all creators to follow. So having direct contact with them, having my scripts reviewed, having my videos reviewed, going back to look at the process and refining the process in terms of feedback, and then seeing how that impacts performance and engagement, and also reaching the audience that we're trying to reach. So that's point number one. And point number two is having access to their audience, which is our audience, so the general public, and we are trying to feed information to them. So, you know, I'm sure there are millions of people who look at the NHS channel who are not subscribed, and it's very common that people don't know what subscribing even means. There is a bit of a language barrier, a digital literacy barrier for people who engage with content. So it's important to not focus too much on vanity metrics and think more about the wider impact. And also, as a content creator myself with a small following, there's no way I could get the data that I can get with working with the NHS team on my own. It would take many years to build that. And so I'm breaking new ground as a smaller content creator at the moment who can produce highly accessible content with plain language and using subtitles, speaking slowly. There are lots of techniques that I'm finding other creators are watching and adopting, you know, adapting scripts that I've created. So it's really great to see that the content I'm creating is not only helping people's health, but it's also helping other creators to create. And so hopefully that will encourage a greater diversity in the creator community pool. So there are more of us in terms of our different healthcare backgrounds. So we all work together as healthcare professionals in a shared content kind of agreement and plan. So pharmacists work with doctors, with nurses, with physiotherapists, with psychologists. So by seeing more of our faces, the public will also know that we're here, we're present, we can help you, and, you know, seeing us all together, putting in the effort, can prompt them to go and get that diagnosis, go and get that advice, visit their pharmacy, see their doctor, and that's the impact that I want to have personally as a healthcare professional. And I think deep down, that's one of the reasons why we get into our profession. So that's the biggest value add. And then of course, having that impact means that you're at the forefront of how healthcare information is disseminated. So working with the NHS and YouTube means that, as Dr. Sue said earlier, we're very early days, so you can be part of that group of creators that is creating the content that will influence all the future content that is created and have an impact on people's lives. So again, being more inclusive, diverse, and all the kind of structures they're building around us, including the AI dubbing or translating. And I met a creator earlier today who has 3.1 million subscribers, and she is sitting just across from me. Is it Jasmine? Jasmina? And her content is all in a language which is local to the, hospital that she works at in Cambridge, and they've also created an app in that specific language. So there are lots of pockets that align with, the diversity that we have in our community, and it's so important to tap into that. So think about what makes you unique and the audience you want to reach, and you will find them and they will find you.
So you heard it here first. It's Wave 2 OG creator opportunity to be had.